Hello, everyone. Welcome back. Good afternoon. Thank you for joining us. I'm Steve.
And I'm Scott.
Together, we're Backyard Musings, Apple Valley, People's Republic of Crazy California.
Yep. Newsom is on the loose and doing some crazy stuff.
Newsom is loosing.
I think he's only got one term left.
Katie Porter, man. The crazy might take over.
She's even crazier.
The crazy might get
Not only
voted
that,
in.
she's violent.
Yeah, I know.
She's just like
boiling pot of potatoes over her ex-husband.
Yeah, he just calls him out all the time. And I mean, just no.
Well, I guess if you're a Republican, now's the time to run against her. You know what?
Yeah, well, we got a few people, I think.
Man,
I don't know how successful they're going to be, but
horrible. She got voted
got
in.
the sheriff of Riverside County. He's going to run.
Steve Hilton.
Bianco. Steve Hilton.
Yeah.
In fact, he's right up there.
Yeah.
And if she keeps pouring potatoes over people's heads, she might lose a little momentum. Might get a job as a cook.
I love his humor, man. That's good.
She's crazy. I've heard a couple of her going off on people, reporters or staff.
Get out of my shot. I don't say that to Cameron.
Yeah.
I try and shoo him away.
Yeah, she's out of it. Anyway, here we go.
Overdose deaths among adults 65 and older from fentanyl mixed with stimulants have surged 9,000%, revealing a growing threat to seniors.
That's huge.
That is eye-opening. I didn't know that. Experts warn that age, medications, and health conditions make this group especially at risk. Overdose deaths among people 65 and older linked to fentanyl mixed with stimulants such as cocaine and methamphetamines have skyrocketed by 9,000%. Who would think that older people are taking cocaine and methamphetamines over 65?
Well, those people are from products of the 60s and 70s. So, that was sex, drugs, and rock and roll, back in those days.
So have skyrocketed by 9,000% in the past 8 years, reaching levels similar to those seen in younger adults. The findings presented in Anesthesiology 2025 annual meeting highlight an alarming and often overlooked trend affecting older Americans. Would you like to know more?
Well, they're not going to be older for very long if they keep taking this stuff. So, yeah. This research is one of the first to use Centers for Disease Control and Prevention, the CDC, data to demonstrate that older adults, a group rarely centered in overdose studies, are now deeply involved in the growing wave of fentanyl stimulant fatalities. These 65 and older are particularly at risk because they are more likely to have chronic health issues, take multiple medications, and process drugs more slowly as they age. Because, I'm sure these people are taking this stuff for pain or whatever, and they're becoming addicted to it. But with this fentanyl, man, that's dangerous stuff. I mean, it's killing hundreds of thousands of people.
I could have used a pain reliever last night. My thumb is going out of whack right now and throbbing. Hard for me to get some sleep. I could have used some codeine 3 last night.
Yeah, and the worst thing you know about this is that you don't even know how it happened.
I don't know how it happened. I didn't smash it. Look at this, people. Look at that. And it's a lot worse. Remember in church I showed you it's just a little sliver of purple.
Yeah.
Yesterday morning.
Maybe a hangnail or something.
Yeah. And look, a hangnail. And now it's the black and blue is into the thumbnail. And it's puffed. It's puffed.
It looks like you smashed it in a car door
I know.
with a hammer or something.
I promise you that did not happen. I would remember that.
You need cameras.
I do. Maybe like the Axon body cams.
Or in your house.
Yeah.
Maybe there's some kind of evil spirit in there walking around with a hammer.
Oh man, I don't even want to think of that. The opioid crisis has evolved through 4 distinct stages, each dominated by a different substance driving overdose deaths. Prescription opioids in the 90s, heroin around 2010, and fentanyl beginning in 2013, and a combination of fentanyl and stimulants starting in 2015.
Quote, a common misconception is that opioid overdoses primarily affect younger people, said Gab Pasea, MA, lead author of the study and a medical student at the University of Nevada, Reno, School of Medicine. Beautiful campus there, by the way. Oh. Our analysis shows that older adults are also impacted by fentanyl-related deaths and that stimulant involvement has become much more common in this group. This suggests older adults are affected by the current fourth wave of opioid crisis. following similar patterns seen in younger populations. Now, this opioid or this fentanyl stuff, it's almost like they're using this to add to it or to cut it. And are these guys not paying attention when they're doing this? Because that stuff is lethal.
It is lethal. Like molecules of it is lethal.
Yeah, pinhead size
certain
stuff.
Death, like a black mamba.
Right.
There's death, and then there's certain death.
Yeah. So why are we? I don't know. Where are you getting this stuff from? I guess if it's got fentanyl in it, is it coming from China? Is it coming from Mexico?
Well, if it's coming from Venezuela, they get blown out of the water. You know what I'm saying?
Yeah. Or they had a survivor. They interviewed a survivor. Did you see that?
Yeah, you fish them out of the water.
Yeah.
Straight from a James Bond movie.
Yeah. I don't know how he did it, but anyway.
To examine the trend, researchers analyzed 405,000 death certificates listing fentanyl as a cause of death between 1999 and 2023. Wow, that's a lot of looking. Using data from the CDC wide-ranging online data for epidemiologic research. Wonder system. It does spell wonder. Wide-ranging online data. Of these, 17,000 deaths were among people aged 65 and older, while 388,000 were among those aged 25 to 64.
Between 2015 and 2023, fentanyl-related deaths rose from 264 to 4,144 among older adults, a 1,470% increase. That's a big number. And from 8,513 to 64,694 among younger adults. Folks,
crazy.
Yeah, figure out what you're taking here. My gosh. The most striking findings was the rapid rise in deaths involving both fentanyl and stimulants. Among older adults, these cases grew from 8.7% to in 2015 to 49, almost 50% in 2023, a 9,000% jump. Wow. Just crazy. For younger adults, word of wisdom, man.
Word of wisdom.
You're putting in your body. Come on.
Word of wisdom.
And if you're addicted to this stuff because of pain, figure out something else. Come on. For younger adults, the proportion rose from 21.3%, 1,812 people of 8,513 to almost 60% over the same period, an increase of 2,115%.
Gee whiz. What is driving it, man? Was it the open borders? Getting the fentanyl in?
Yeah. And do you not know some of these people that are dying and you're taking the same stuff? I mean, come on.
This is eye-opening.
It is eye-opening.
The researchers highlighted data from these individual years between 2015 and marked the onset of the fourth wave of the opioid epidemic, and was also the year fentanyl stimulant deaths among older adults were at their lowest, and 2023 as it was the most recent year of CDC data available.
The researchers noted that the rise in fentanyl deaths involving stimulants in older adults began to sharply rise in 2020.
Well,
that's around
COVID. Yeah.
While deaths linked to other substances stayed the same or declined. Cocaine and methamphetamines were the most common stimulants paired with fentanyl among the older adults studied. Surpassing alcohol, heroin, and benzodiazepines.
Yeah. Xanax and Valium.
Yeah. Such as Xanax and Valium, yeah.
Yeah, sometimes I wish I had Xanax because I start getting bouncy all over the place. Quote, national data have shown rising fentanyl stimulant use among all adults, said Mr. Peja. I thought that was a woman.
I guess not.
Continue the quote, because our analysis was a national cross-sectional study, we were only able to describe patterns over time, not determine the underlying reasons why they are occurring. However, the findings underscore that fentanyl overdoses in older adults are often multi-substance deaths, not due to fentanyl alone, and the importance of sharing drug misuse prevention strategies with older patients.
Name could have been, was that Gabe, right? G-A-B or Gab?
Gab.
Could be short for Gabrielle. That's usually a female way of pronouncing it too. Gabriel.
Inspector Clouseau.
Yeah. The authors noted that anesthesiologists and other pain medicine specialists should recognize that polysubstance can occur in all age groups, not only in young adults.
Be cautious when prescribing opioids to adults 65 or older by carefully assessing medication history, closely monitoring patients prescribed opioids, who may have a history of stimulant use for potential side effects, and considering non-opioid options when possible.
Yeah, so pay attention to what your doctor's prescribing to you, right?
Yeah.
And don't be afraid to ask them what's in it, or at least the pharmacist when you go to pick it up. Use harm reduction approaches such as involving caregivers and naloxone education.
That's the overdose thing.
Yeah, like Narcan.
Yeah, brings you back.
Yeah. Simplifying medication routines, using clear labeling and safe storage instructions, and making sure instructions are easy to understand for those with memory or vision challenges.
Just last night, because my vision is bad, close up and in dim light, and so just last night I was looking for muscle relaxant because I haven't slept. We went camping Friday on the ground. I didn't get much sleep, and then Saturday night, dumb thumb was throbbing. Didn't get much. And last night, dumb thumb was throbbing. I didn't get much sleep, so I said to Sherry, read this prescription. What does it say? Because I couldn't read it. It was dim light.
Something bit your thumb when you were out there.
I don't know, but it didn't. Would it take that long?
It could, yeah. I've had bites on my arm from when I've been out fishing and stuff.
Thank goodness Cameron didn't get bit.
Yeah, or somebody else, but I mean, maybe did it.
Screen older patients for a broad range of substance exposures beyond prescribed opioids to better anticipate complications and adjust perioperative planning. Wow. Okay, this is eye-opening.
Be careful what you ingest. I mean, it's just scary stuff out there.
And I've got two. I've got VA, primary care physician, and Kaiser, and
those
systems don't communicate.
Yeah, those systems don't. That's not good. It's not good.
So I got to tell them what I'm taking every time I go.
Yeah, so as you know, I have a friend that I'm helping.
Yeah.
And she's got a couple of different prescriptions. And I went to pick up her last prescription, and the pharmacist said, make sure she doesn't take these at the same time. I said, well, I'm not with her all the time. And she's
lock it up,
going through some issues. What's to say she doesn't do that when she's by herself? She pops the wrong pill or pops them all at the same time. She said, well, it's just not a good idea. I'm thinking, really? Can you elaborate? I mean, is she just sort of walking on the ceiling, or what? But anyway, I mean, it's like they don't care. But anyway.
Yeah, put the medicine to it. See you later.
Just watch what you ingest,
All right, folks, thanks for joining us. We'll catch you in the morning.
Take care, everyone. Thanks.